guys, welcome back to my channel. Thank you for clicking on this video. This is a coffee and chat, which I'm not actually drinking coffee. I'm hydrating with water. Not tripped. I'm hydrating with water because it's like 3:30. It's almost 4 o'clock. And I want to be able to sleep tonight, so I'm not drinking coffee. But coffee and chat is just like a very casual, informal way of me to just sit and talk to you guys. So this is actually my second time filming this video. I literally just finished filming it. And then I was like, I think that I just kind of rambled and it was all over the place. So I'm just going to go ahead and refilm it. And I'm just going to go ahead and get started. So first off, I am no longer an ICU nurse. That is not clickbait. I'm no longer in the ICU. I lasted in the ICU no longer than John is in the Army, if you guys know that expression. I do still work at the same hospital. So I'm in a nurse residency program. I'm still in the program. I'm still at the same hospital. I just transferred to a different unit. I now work in the PCU, or on the PCU, which is the progressive care unit. So pretty much, I think it's different at every hospital. I don't even know if every hospital has a PCU. But at my hospital, the PCU, the progressive care unit, is still critical care. I think it's definitely not critical care or considered critical care at every hospital. It is at mine though, and I think that's because the director of the ICU is also the director of the PCU. We have the same staff educator. It's kind of like under the same leadership umbrella. And then a lot of the nurses on both units are cross-trained, so they can work in either unit. So if the ICU has really good staffing one day and the PCU is short on nurses, then the ICU will send over ICU nurses to go work in the PCU and vice versa. So there are a lot of nurses that can work or do work on both units. And so it is considered critical care. So there are a few main differences at my hospital for the ICU and the PCU. Basically, the PCU is our step-down unit. So it's kind of like for patients that are not critical enough to be in the ICU, but they're too critical to be in a general med-surg unit. But anyway, how we got here, how I left the ICU. So to be completely honest, in hindsight, I don't think I was really happy on the ICU. Like, I made a couple of videos and I've uploaded them on YouTube talking about my experience in the nurse residency program. And I've gone back and watched certain part, like a little bit of each of those videos. And I feel like I looked really sad and I feel like I sounded really sad. And I feel like that was just my whole mood being on the ICU. Like, to be completely honest, it is extremely hard. As many of you know, or as you can assume, it's really, really hard leaving nursing school, having no previous clinical or direct patient care experience, and then just starting on the ICU. It's literally like going from 0 to 100. And many people, probably most people, cannot do it. I could not do it. I hate saying that like I failed, because I don't see it in that sense. But if you look at it in that sense, yeah, I went to the ICU. I failed, and now I'm on a different unit. And so, like, just going into work every day, I wasn't at a point where I was dreading going into work, thank God, because I've worked at jobs where I was literally like dreading going into work. Sometimes I would get sick before work because I was so anxious. It wasn't at that point yet, thank God, but most days I would leave the hospital just feeling completely defeated and just feeling like it was a bad shift. I think I even said in one of my previous videos, I was going to give myself a year before I decided, like before I definitively decided whether or not I liked the ICU. But I was like, really right now it's just shift by shift. And that's kind of how it was. Like, if I would go to work and have a decent shift, I'd be like, okay, I can do this. It's not so bad. But most days I would go to work and not have a great shift. And I would just leave feeling overwhelmed and like I couldn't do it. And I was actually getting to a point where I was thinking about asking my nurse residency program if I could transfer to a different unit. I was not thinking about the PCU. I wanted to leave the ICU, skip over the PCU, and I was thinking about trying to be a med-surg nurse. So that's where my head was at. I was kind of secretly debating, should I just try to go to med-surg and be a med-surg nurse, and then as I feel comfortable, maybe later on down the line I could try the ICU again. But what ended up happening was I have in the nurse residency program at my hospital, you have a touch base. So I had a preceptor. I was still on orientation, so I was working with an experienced nurse every shift. And like once a month, I would have a touch base with my preceptor, the team lead in my nurse residency program, the like unit manager, so the manager of the ICU, and then sometimes the director of the ICU would sit in on those meetings. And so I would have those meetings once a month, and I would give feedback like, oh, you know, I feel like I'm learning a lot, which was true, but I just don't feel comfortable yet. And they would all tell me like, don't worry, this is totally normal for all new nurses. You'll gain that confidence, you'll gain that comfort. But it wasn't really reassuring me. And like as time was going on, and as I was getting closer to the end of my orientation, because in the ICU at my hospital, every unit has like a different amount of time for orientation. The ICU's was 20 weeks of orientation where you're working with someone, and then you're expected to go off and start on your own. So as I was getting closer to the 20 weeks, I was just really second guessing myself. I was like, maybe the ICU isn't for me. I don't feel comfortable. I'm definitely not ready to get off of orientation. So I was really honest in one of my last touch bases. The director of the ICU was sitting in that one. And I was just totally honest. I was like, I don't feel comfortable. More importantly, I don't feel like I am. Like, I don't feel like my skills level, my confidence level, my comfort level, I don't feel like I am where I should be to get off of orientation. And I was honest, and I was just like, I don't feel like I'm ready to leave orientation in a few weeks. And so based off of my honesty, the director of the ICU was just like, okay, what would you rate yourself? He gave me some scale. He was pretty much like between like a good nurse, a great nurse, and an excellent nurse, which is, you know, the ICU nurses at our hospital, we want them to be excellent. Where would you rate yourself? And I thought about it for a minute, and I was like, if I had to rate myself based off of your scale, I would say a good nurse. But to be completely honest, I feel like I'm a decent enough nurse. Like, I feel like I'm just trying to get by every shift. And so he thought about it for a minute, and he was just like, you know, I really appreciate your honesty. Why don't we do this? Why don't you go down to our PCU, our step-down unit, the progressive care unit, for 6 months, gain some skills, gain some confidence, and then I don't want you to stay in the PCU. I want you to come back up to the ICU in 6 months. And he asked me how I felt about it. I was honest. I did feel a little bit disappointed. Not because the ICU was so special to me, but just because I don't like to quit. I don't like to fail. And so I was kind of like, even though when I really sat and thought about it and I was honest with myself, I really didn't like the ICU. But I was just like, you know what? I'm here. I want to make it work. I'm going to do whatever I can to make it work. I don't want to fail. So I felt disappointed and a little bit discouraged that I just couldn't make it work. But I was honest with him about that. And I was like, but I understand why you suggested that for me. And I think in the long run, it will make me a stronger nurse, which I do think it will make me a stronger nurse. Okay, I'm trying for this video to not be all over the place, but that is pretty much a basic summary of I am no longer in the ICU. I'm now in the PCU. And to be honest, I've only been in the PCU for a few weeks. And I'll also be honest, I'm not planning on uploading this video right away. I am filming this video, and it will be at least a couple of weeks, maybe a month, until I actually post the video. And I'll get into that in a second. But as of me filming this video, I've been in the PCU only for a couple of weeks. So by the time that I post this video, I would have been there for over a month. But as of me sitting here talking to you guys, filming this video, I can say I absolutely love the PCU for so many reasons. Number one, I feel more comfortable. The patients are still critically ill. To be honest, the PCU scared me a little bit more than the ICU did because it's still critical care. The patients are still critical. In the ICU, the patients are monitored more closely. So we take vitals in the ICU every hour. Sometimes, depending on if the patient is on a vasodilator, on a certain drip, we will take vitals every 5 minutes. In the PCU, patients are still critical they're less critical, they're more stable, but they can turn really quickly in the PCU because it is still critical care, and they're not monitored as closely. So we're not taking their vitals every hour, every 5 to 15 minutes. Their vitals are getting taken every 4 hours. And then there are no monitors in the room. Not every patient is on tele. Most are. It's like 95% of patients are on tele monitoring where you can see their cardiac rhythm. But most patients, of the patients that are on tele, it's being transmitted at the nurse's station. So you could be in the room with a patient and their oxygen saturation could tank, their blood pressure could tank, they could go into a cardiac arrhythmia, and you don't know. So to me, that was really scary. But even with all of that, that does still make me nervous. But if anything, it just makes me go and round on my patients more frequently. But the patients are not as sick. The medications are not as confusing. I don't have as much responsibility on me. In the ICU, I honestly felt like I was like a mini doctor where I was not diagnosing patients because that's not in my scope of practice, but I was almost expected to like unofficially diagnose a patient and then reach out to the physician or the intensivist, let them know what was going on, make a recommendation for a treatment. And I thought it was really cool. It's a great learning environment, but it's really, really hard to do all of those things when I have no patient care experience. So I think the ICU, I do want to return there one day, but I want to return there after I gain skills and after I gain that critical thinking to know what the hell I'm doing. It's really scary when a patient, their condition is tanking and I'm kind of expected to know what to do when, it's not like nursing school where it's a case study where you have infinite time in the world to figure out what to do, or you have multiple choice where the answers are right in front of you. So it was just a lot. And I think it's something that you get better at as you get experience. And I have no experience. So I'm really happy to be in the PCU. So that's one thing. The patient acuity is lower. The amount of responsibilities that I have is lower. Really, the doctors are making decisions. I still make suggestions, but it's like the doctors are making decisions. And then I am acting out those decisions, those orders. So it's making me feel more comfortable. I'm learning about different medications. I feel like I'm learning at a faster rate in the PCU versus the ICU where I was kind of expected to just know a lot going into it. Another thing is just the overall environment and the tone of the unit, like the mood of the unit. At least in my hospital, in the PCU, well, the ICU, I will say, everyone was really friendly in the ICU. Everyone in my organization is really nice. I'm very, very fortunate. But it was just very serious. And I felt really isolated. I felt like I didn't really fit in very much. I think part of it was because, I had my patients, I had my own little mini workstation, and I was just there kind of working by myself with the patients. And then I'd go to the break room for lunch, and everyone, I guess because it's so intense, people just kind of try to disassociate. People would like joke around and talk with each other, but 90% of the conversations that I was a part of or welcome to be a part of were about patient care, which can get really depressing. And then other people would just kind of like put in their headphones or talk to their friends and just kind of like try to disassociate, I guess, for their mental health. So I just felt really isolated. I felt weird and uncomfortable, and like I didn't fit in on the ICU, even though everyone was friendly, but I just didn't really feel like, I just kind of felt like I was crawling out of my skin sometimes being in the ICU. Versus in the PCU, we have like a legitimate like nurses station where all of the nurses work, because we don't have, like, we have mobile stations, the computer on wheels or the workstation on wheels. So if you're going into a patient's room, you take the computer. But if you're just like sitting there charting or doing anything else other than like medication administration, you go to the nurses station, which is where everybody is. And because it's not like intensive care, it's not the ICU where people are kind of actively declining or dying a lot of the time. It's just like less serious. So now, yes, of course, I talk about like patient care, but now I'm able to hear more about like people's families and actually like feel like I'm forming relationships. And when I go to the break room, it's like very communal. Like just my whole day is just more communal with the other nurses on the unit. I feel like I fit in more. I feel like their sense of humor and their attitude and their personalities just are similar to me, and I don't feel weird going into work and talking to people. I feel like there's also more staff on the unit, because in the ICU, it's really just like all nurses and intensivists, so the hospitalists, like the physicians, versus in the PCU, we have techs, which I love techs because they help out with so much. That's another thing. I'm able to delegate certain tasks so I don't feel as overwhelmed in the PCU because I have techs to help me out. But yeah, just having like nurses there and techs there, and then people from other departments kind of casually coming in because it's not a locked unit like the ICU was. It just feels more chill and less intense, and I feel like I'm actually able to like make friends and make connections with people. Another thing are the patients. Like 95% of my patients in the ICU were not conscious for one reason or another, whether they were medically sedated or they just were that sick. They were not conscious. They had like trachs in, or they had the ET tube and they literally couldn't talk to me. Now in the PCU, my patients can talk to me. And some people really don't like that because people can complain. But even with people complaining, like I've realized I'm definitely a people person. And so I like going into my patients' rooms and hearing, even if they're complaining, I like hearing them talk. I like, a lot of people are really chatty. Like I like hearing what they do for a living. I like having their family come in and their family's joking with me, their family's joking with them. I like when I have a patient who is really involved in their care, and if they have 10 medications, they want to know what all 10 of those medications do. Yes, it slows down my day, but at the same time I've learned, like it's helping me learn, because before I go into a patient's room, I'm making sure that I review every single medication that they're getting, why they're prescribed these medications. Like I have to know my stuff because my patients are alert and oriented for the most part, and so they're able to question me on things. And so it's helping me learn different medications. It's helping me memorize different medications. And it also kind of helps from making mistakes. So if a patient is like alert and oriented and they're totally with it and they know about their care, if you're going in to administer medication, they can tell you, oh, I should not be taking that medication, or oh, are you sure that's the right dosage? And just kind of like, it's just like another layer of checks and balances. And then I really do like talking to people. I like connecting with people. I like hearing their story. So especially when I get like my older patients, they love to talk about themselves. Like I do like hearing what people do for a living and about their children and stuff like that. So as I'm caring for patients and they're talking to me, that really makes my day go by faster, and I enjoy that more than going into a patient's room and the patient is not conscious. They have tubes down their throat. It's just depressing. So overall, all of that, the environment, the staff, the tone of the unit, the patients are less acuity. I'm not responsible for making as many decisions as the ICU. I'm really, 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 really happy in the PCU. So the plan is for me, after being there for 6 months, to return to the ICU. I'm not opposed to it. If I feel like I'm ready to return to the ICU, I don't want to like stunt my growth. But I feel like maybe even after 6 months, if I really like the PCU, I'm not opposed to staying there, just because I really want to be happy. And I feel like in hindsight, I was not happy on the ICU. And in the PCU so far, I'm really happy. Like, I'm happy going into work. I'm happy when I leave work at the end of the day. I enjoy my lunch break. I get to talk to people. The whole shift, I get to like talk to people and get to know people. I no longer feel like I'm some weird loser outsider. Like, I don't know. I feel like I fit in more in the unit. And to me, that is priceless. So we'll see. Also, another important life update. I'm pregnant. I am with child. I don't even know if you guys can see my corny sweatshirt. I told myself I'd never get one of these, but I have a sweatshirt that says mama, just because I was in TJ Maxx looking for maternity clothes, and this was on clearance, and it's so soft and it's just big and oversized and it's comfortable. But I'm having a baby. My husband and I are having a baby. That has been it's been a blessing. Okay, so I feel like I'm sounding like, okay, so I am really excited that I am pregnant. I'm really happy. My husband's really happy. In my like personal life. Professionally, it's been hard. I feel like I was working for 2 seconds before, like as a nurse for 2 seconds before I found out I was pregnant. And to be completely transparent, it wasn't something I would say, it wasn't unplanned, but it wasn't exactly planned. If you couldn't tell by just like my videos and like my work ethic, I'm somebody that likes to plan out things. I'm really particular about like planning things and making sure things happen in a certain order. And my plan was not to start working and immediately get pregnant, but that's kind of what happened. But my plan was that I would work for a while, and then maybe like towards the end of 2024, like around Christmas time or early 2025, we would start trying. And just from like my friends and people are really, people have been more open, I would say, in recent years about talking about like fertility struggles. So I looked it up and I was like, okay, it takes on average a woman like 3 months to get pregnant if she has no difficulty getting pregnant. So I was like, okay, we can start trying like maybe December, January. It'll probably take us like 3 months to get pregnant. And then by the time that we have the baby, I would have been at work for over a year and I'd have all my benefits and this and this and this and this. And that's not what happened. Before we decided to start trying, a few months before we decided to start trying, I'm not going to get too much into my personal business, but I will just say we had a night, we had a moment, we had a spur of the moment, very spur of the moment decision to just be like, what'll happen? And at one time, you know, it didn't take me 3 to 6 months to get pregnant like I had anticipated when I was planning out my life. It took one time. So that was a blessing. I'm very blessed. I'm very fortunate for that. But it wasn't what I was planning. So it was kind of like, oh wow, okay, I am pregnant. And the way that I found out, because we weren't really like trying, was that I actually had a needle stick incident at work. For those of y'all that don't know, a needle stick incident is where the needle, like if you're giving a shot or starting an IV, but pretty much a needle goes inside of a patient and then it goes inside of you afterwards. And so I was starting an IV. I'm terrible at starting IVs, but yeah, I tried to start an IV with the patient. I went inside of the patient and I took the needle out to try again. And the patient shifted, things got shifted, and the needle stuck me. So I had to fill out paperwork. Part of my hospital's policy is that you have to get tested, and the patient has to get tested just to see what you've been exposed to. And so thank God, by the grace of God, I was not exposed to anything like HIV or hepatitis, because I was really, really anxious about that. But when my blood work came back, it showed very, 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 very light traces of HCG or something like that, the pregnancy hormone. And so that was not a shock, because obviously I knew how it happened, but I was just kind of like, oh wow, especially since like my period was a couple of days late, which it usually is not. So I already knew, okay, there's a possibility. But I found out when I was like, the traces of the pregnancy hormone were so low that when I got my results, I had to like go in for a follow-up appointment and everything. But when I got my results, the person that called me on the phone to give me my results was just like, it's estimated based on the trace of hormone in your urine, because they can estimate how far along you were. They were like, it's estimated that you're like 1 to 1.2 weeks pregnant. So I found out I was pregnant when I was probably like a little bit less than a week pregnant, once I ended up going and like doing my first ultrasound and everything, seeing how big the baby was. So that has been really, it's just been a lot. Like I said, in my personal life, it's been a blessing. It's also been kind of scary, because I had this vision of how I was going to get pregnant, when I was going to get pregnant. And as you're making plans, God just laughs. And so I thought that I'd probably find out I was pregnant when I was like maybe 2 or 3 months along, like out of my first trimester, because that's when a lot of people find out that they're pregnant. since I found out so early, I've like had this thing in me of just being anxious, because the chance of having, I don't even like saying the word, but the chance of having a miscarriage is higher in your first trimester. And so even when I found out I was pregnant, my husband automatically was just excited, because in his mind, he's like, okay, if we're pregnant, there's gonna be a baby in 9 months. In my mind, especially being a healthcare professional, I'm like, okay, just because you get pregnant doesn't mean that there's gonna be a baby in 9 months. Anything could happen, especially early on in the pregnancy. So from the beginning of my pregnancy, to be like totally honest, I've been more fearful than anything. Even though I don't have like a history of that in my family, I've never experienced that by the grace of God. I will never experience that, hopefully. But just initially, my first thought was just like, I'm barely pregnant. If I sneeze, something bad is gonna happen to this baby. So I would say like my whole first trimester, I was just scared and didn't really tell anybody. And as I'm filming this video, I'm halfway through my pregnancy. So far, knock on wood, by the grace of God, so far everything has been healthy. On paper, I'm having like a perfect pregnancy according to my doctors, no issues, no complications. But in actuality, I've been suffering from like nausea every single day. I'm like, my baseline is just nauseous and sick, but I've only vomited once my entire pregnancy, so it's not like I have it's not like an issue on paper again, but I've been feeling like crap. I've also been having like extreme fatigue. I've never been tired like this in my life. And so I was going through all of that while I was working in the ICU, which just made things hard. Like, there were days where I really wanted to call out from work. I was so freaking tired. I was so nauseous. I felt so sick. And I just went to work and I just suffered through it. But like, I feel like mentally and emotionally, I wasn't fully there. One thing that really helped me, like when I very first started in the ICU, my method was to like go in early. So I would go in like 30 to 45 minutes early. I would review my patients, review their medications, get myself organized for the day. Once I was pregnant and then once I became symptomatic, like getting out of bed was just, like, I've never felt anything like this. Even getting out of bed was just hard for me. So I found myself sleeping in later and later. I found it really hard to go in early to start reviewing patients' charts. So I would just go in right when it was time for me to start my shift, just kind of going in blindly, which I would not recommend any new nurse to do, but I was just so tired. I physically could not get out of bed any sooner. So I just felt like I had a lot going on in my personal life. I didn't want the stress of work to be affecting my pregnancy. I still don't. So all of these things kind of made me think, I don't think the ICU is for me at this time. That led me to being honest in my touch base. That honesty led me to going down to the PCU. And I think it's the best thing that could have happened, not just for like my emotional well-being, and for me as a nurse. I think it's going to make me a better nurse in the long run, but also just for my pregnancy, like letting go of that stress. Like, I don't take the stress of work home with me. I'm not anxious before going to work in the morning. Like, I'm really just able to just focus on work when I'm at work. And then when I'm home, I just focus on resting and taking care of myself and taking care of the baby. So that is pretty much everything that is going on with me. I don't want to upload this right away just because I haven't like announced my pregnancy. A lot of you guys, I don't know about a lot, but some of you guys like are of my culture. I'm West African, I'm half Liberian, half Sierra Leonean. We don't really go out and announce pregnancies for so many reasons. I'm very religious, I'm very superstitious. I do believe in the evil eye. So I was never gonna actually like flat out announce my pregnancy, but it's just the fact that I think that it did contribute to me not doing as well in the ICU. I definitely would have struggled without my pregnancy, but I think I may have been able to handle it better. I would have been able to focus more on work. When I wasn't at work, I would have been able to like be doing research on different drips and medications in the ICU. So I think it would have been, I don't know for sure if I would have been able to handle the ICU if I wasn't pregnant, But me being pregnant definitely didn't help. And so all that's to say, since I feel like that contributed to me no longer being in the ICU anymore, I felt like it was important to share it with you guys. But so I don't want to upload this, even though as of me filming this, I'm like more than halfway through with my pregnancy, but I want to just wait a little bit longer. I want baby to cook a little bit more before I like announce to people. Pretty much like my friends know, not even all my friends, my close friends, like my very close friends know, my immediate family, some of my cousins know, but I haven't, it's just been like, as I've been seeing people, as I've been hanging out with people, going to their houses, meeting up for lunch and dinner and stuff, I've just been like, oh, by the way, I'm pregnant. So I guess this is me in a way announcing it to people. So yeah, I just want to wait a little bit longer, maybe a couple more weeks for the baby to cook a little bit more before I, tell people. But thank you for watching this video if you made it to the end, and I will see you guys later.